Tensions explode in Congress. What starts as a routine hearing quickly turns into a heated confrontation. Accusations fly, questions go unanswered, and frustration boils over. At one point, the exchange gets so intense, he cuts him off mid-sentence.
You down, Chairman. I now recognize the ranking member of the full committee for his 5 minutes of questions, Representative Pallone.
Thank you, Madam Chair. You know, Secretary Kennedy, I'm shaking my head because you mentioned President Kennedy. And I went with my dad to work on his campaign, and we worked on your dad's campaign for president. But these guys were tough. I remember during the Cuban Missile Crisis when President Kennedy forced Khrushchev to back down. He was a tough guy. But at the same time, he was determined to help the little guy. And we talk about President Johnson and the Great Society, but most of those initiatives, Great Society initiatives, started under President Kennedy. Johnson continued them. But we don't have a strong president now. We have a weak president. Trump lets Russia and China walk all over us. You mentioned yourself that China's eating our lunch. You know, and President Trump doesn't care about the little guy. He just cares about billionaires, about corporate interests. On April 1st, President Trump actually stated, and I quote, "It's not possible for us to take care of daycare, Medicaid, Medicare. They can do it on a state basis. You can't do it on a federal basis. We have to take care of one thing, military protection." So my question is, do you know what Trump's reckless, illegal war with Iran is costing us right now? Do you have any idea?
Frank, I remember when you were the champion.
All right, I'm not going to get into it because you're not going to answer the question. As of April 10th,
well, you said some things about my family. I'd like to reply to.
I'm cutting you off because you won't answer the question. As of April 10th, the American Enterprise Institute estimated the incremental cost of the war at between $25 and $35 billion. And it has been reported that the Pentagon has submitted a $200 billion war supplemental spending request to the White House in anticipation of sharing it with Congress ahead of another likely reconciliation bill. So I have a question, Secretary Kennedy. Do you believe that further cuts to health care programs, including Medicare, Medicaid, and the ACA, are necessary in order to pay for Trump's ongoing war with Iran? Yes or no?
There is no cut to Medicaid.
Oh, okay.
Look at the Congressional Budget Office report.
Mr. Secretary,
we're increasing Medicaid spending by 47% over 10 years. How is that a cut?
You will commit here today that you will oppose any cuts to federal health care programs to fund the ongoing war with Iran. Will you commit to that?
We are not cutting Medicaid.
We're not cutting Medicaid.
You said that, and it is not
okay,
true.
let's forget about the past. Will you commit to oppose any cuts to federal health care programs to fund the ongoing war with Iran in the future? Forget the past.
Frankly, you know, I want to talk to you about what you said about my family.
Look, you know, let me just say, it would cost to provide 2 years of funding for the enhanced tax credits so families can afford their insurance premium, which is, you know, which this administration and congressional Republicans have refused to extend. It would, for 2 years of that funding, let me just give you some statistics about how this compares. The fact is, extending the enhanced premium tax credit for 2 years will cost a fraction of the cost of the Iran war, just over a quarter of that supplemental funding request that we expect to come from the Pentagon. So you can argue all you like, but the reality is that this administration and congressional Republicans are making a choice. The choice to fund another endless war that is only raising prices for working families when they could be helping millions of American families here at home afford the health care that they need. But what concerns me the most is not only that we've had this $1 trillion worth of cuts under the big ugly bill, and that all our hospitals are suffering, and that people can't afford their health insurance, but the administration dares to come forward and say, even with all that, we're going to do more reconciliation with more cuts to health care, and says that the reason that we're doing this is because we have to pay for this ongoing war in Iran. It is simply not acceptable to do that. And I don't want to keep bringing back, you know, President Kennedy, but the bottom line is that President Kennedy, who you mentioned, you know, I wouldn't have brought it up, but you brought it up. He was tough on Russia. He believed strongly in a strong military, but at the same time, he wanted to help the average person. He wanted to, you know, provide better health care. He wanted to provide housing. He wanted to provide help for people who were suffering. He was concerned about poverty and started the war against poverty. But this president doesn't want to do that. He just wants to fight wars. And he says blatantly, he doesn't care about the little guy. He doesn't care about, you know, their concerns. So with that, I yield back, Madam Chair.
In this heated exchange, Frank Pallone confronts Robert F. Kennedy Jr. over a deeply controversial issue, the cost of war versus the cost of care. Right from the beginning, you can feel the tension building. Pallone sets the stage by comparing past leadership to the present, referencing figures like John F. Kennedy and Lyndon B. Johnson, leaders he portrays as strong but also committed to helping everyday people. That contrast is key. It frames the argument that current leadership priorities may be shifting away from domestic support toward global conflict. Then comes the central issue: money and priorities. Pallone brings up staggering figures: tens of billions already spent, and potentially hundreds of billions more requested, tied to military actions involving Iran. His argument is straightforward but powerful. If that much money is going into war, what happens to healthcare? This is where the exchange becomes intense. Pallone repeatedly pushes for a clear yes or no answer on whether cuts to programs like Medicare and Medicaid will be used to fund military efforts. But instead of a direct response, the conversation shifts, and that's when frustration peaks. "I'm cutting you off because you won't answer the question." That moment defines the entire exchange. It highlights a broader issue in political discourse: accountability versus deflection. Viewers are left to interpret whether the question was avoided, misunderstood, or deliberately sidestepped. Another layer of the discussion focuses on priorities. Pallone argues that funding healthcare, including insurance affordability, would cost only a fraction of what's being spent on war. In his view, this reflects a choice being made at the highest level: invest abroad or invest at home. There's also a deeper emotional undertone. References to past presidents aren't just historical, they're symbolic. They represent a vision of leadership that balances strength with compassion, something Pallone suggests is missing. Meanwhile, Donald Trump is mentioned as part of the broader criticism, particularly regarding statements about federal responsibility and priorities.